Hi everyone, thanks for joining the new Director Training Title III-C Nutrition Programs. My name is Caitlin. I am the Nutrition Program Manager for the Aging Division, Wyoming Department of Health. I run the Title III-C1 and Title III-C2 programs. So this presentation is basically just an overview of both programs to give new directors a feel of the program and provide them with some general information. This is an overview of what we will be talking about today. I have just a brief review of the program itself, eligibility for both C1 and C2 programs, services offered, Nutrition Services Incentive Program, which I will refer to as NSIP, key policies, grants and funding, and then program reporting. So both the Title III C1 and C2 programs are authorized under the Older Americans Act, as are most of the in the community living section of the Aging Division. So I mentioned earlier that Title III-C includes both C1 congregate meals and C2 home delivered meals. And while they're different programs, they both have the same program purpose, which is to reduce hunger and food insecurity while promoting socialization and the health and well-being of older individuals. Title III-C programs are non-means tested and should be treated as such. I will expand a little bit more on this in one of the key policies. And as I mentioned earlier, Title III, C1, and C2 are separate programs, which means that they have separate eligibility requirements. Title III, C1 is geared towards those who are age 60 and older, and also includes spouses who may be under the age of 60, disabled persons under age 60 who reside with adults over 60, or disabled individuals who reside in housing facilities occupied primarily by adults over 60. Volunteers who provide meal-related services under 60 years of age can qualify for a meal, and then staff members who are 60 and older. Title III C2 is a little bit different. It has the same age requirement of 60 and older, but they also have to be homebound or geographically isolated. It also includes disabled persons under age 60 who reside with the eligible consumer, and then spouses of consumers are also eligible. Within the Title III, C1, and C2 programs, we have different services offered. In total, we have 4 different services that we provide. The first being case management, which can include several different activities such as assessing needs, developing care plans, authorizing and coordinating services with providers, and then providing assessments and reassessments as required. Please note that if a consumer declines to provide NAPAS data, which for the Wyoming Department of Health is the Aging Needs Evaluation Summary, which is referred to as the AGNES, if they refuse to fill out this document, they cannot be denied service. And please note too that the nutrition risk assessment should be completed at the time of intake, and also an annual update. The nutrition risk assessment is included in the AGNES document. The second service offered is obviously meals. We are a nutrition program. It is required for a meal site to offer at least one hot or other appropriate meal 5 days or more a week. Menus have to be prepared or approved prior to a meal service by a registered dietitian. And if a RD, registered dietitian, is not available, there's also specific language in the policies and procedures about an individual who would qualify as having comparable expertise. Each meal served must provide a minimum of 1/3 of the current daily recommended dietary allowances, and they also have to comply with the most recent dietary guidelines for Americans. Specifically for congregate C1, approved menus have to be posted at the nutrition site. And then, as most on these slides I have included, to please refer to the Title III-C policies and procedures for specific details on each of these different topics. It's very detailed, whereas the slides just provide general information about the Title III-C programs. The next service that we provide and offer is nutrition education. So this has to be provided for both programs and should be based on the needs of the participants. It is required once per quarter by a registered dietitian. A quarter would be every 3 months, so we require this 4 times a year. Whereas a presentation should be provided at least 1 time each state fiscal year at each congregate meal site. When we report this information into SAMS, which is our data system, it is as following: 1 unit is equal to 1 session per participant. So if 30 people show up to a presentation or nutrition education is provided, you would count those as 30 different units. And then the last service we provide for both C1 and C2 is nutrition counseling. This is unique in that we have to offer it, but it is not required because it's based on the assessment and needs of each client that is participating in the program. And once again, this needs to be provided by a registered dietitian. And the reporting of nutrition counseling is 1 unit is equal to 1 session per participant. Moving on, the next thing I wanted to address was Nutrition Services Incentive Program. As I mentioned, I'll refer to this as NSIP. So this is a unique program, and it's an additional program where we receive federal funding to help incentivize and encourage those who provide nutrition services for older adults. It is unique too in the fact that it can only be used to purchase domestically produced food. And the definition of this is food grown in states, territories, tribes, but it can also be food that's been processed or produced in states, territories, or tribes. And the main purpose of NSIP is that it should be used to expand meals or expand access to meals or maintain the number of meals, as we see increases usually in food costs over the years. A meal reported for NSIP is required to meet the Older American Act nutrition requirements. So referring back to that information about the dietary guidelines and dietary reference intakes, an NSIP meal and an NSIP meal being reported as such needs to meet the Older Americans Act requirements as well. The ACL, which is the admin for community living, distributes the funds to us as a state entity, where we disperse them to each provider throughout Wyoming. We have a specific formula we use that is based on the number of eligible meals served in the previous year in relationship to meals served by all Title III programs. So we do give out NSIP meals individually for C1 programs and for C2 programs. So the award is based on the number of meals you have served for C1 compared to all C1 meals served by all C providers in Wyoming. Please note that when filling out a grant application, the NSIP funds that you put in the grant application are an estimate. We don't know when we get NSIP funding, and we don't know how much we will be getting, so we cannot guarantee that what's in your grant application will be received. That is why it is not in the contract. Again, there's quite a bit more information about NSIP in the policies and procedures, so if you have questions, refer to that, or please feel free to reach out to me as well. Moving on, I have included some key policies, the first being that the C programs are non-means tested. I touched a little bit on this in the beginning, but if a consumer refuses to fill out the AGNIS document, they cannot be denied service and they cannot be required to pay the guest fee. These services are supposed to be offered, and we shouldn't be warranting them to pay or provide money or means testing them in any way. The next key policy is voluntary contributions. This is the amount that we ask of the eligible consumers to give to support the services that we are providing. Again, we cannot means test and we cannot require them to voluntarily to contribute to the meals, but we have to give them the opportunity to contribute to the cost of the service they received. Again, services cannot be denied to a consumer if they are reluctant to or do not have the ability to contribute toward the cost of the service. The next key policy is guest fees, and this is the amount that non-eligible recipients have to pay. This is different than a voluntary contribution in that they are required, they are not voluntary. The guest fee amounts should not be less than the suggested donation, which is the voluntary contribution amount for eligible clients. I will touch on this a little later as well, but there is a meal cost reporting tool that can be used to determine guest fees. And if your guest fee amount does change throughout the year for some reason, you do need to notify me or someone at the aging division that the fee has changed. And then the final policy I wanted to address was temporary delivered meals. So this is for congregate clients who may not be able to get to a site because, for example, they could be ill or had a brief surgery that prevents them from being able to drive to a congregate site. A consumer can receive temporary delivered meals for no more than 2 weeks. If it goes beyond that amount, they should be referred to the home delivered meal program. Next, I wanted to talk about grants and funding. So as I've mentioned throughout the slides, Title III C programs receive both federal and state funding. Contract amounts for federal and state funding are based on the prior closed federal year meal count numbers. An example of this is that federal fiscal year 17, the funding amounts in the contract were based on federal fiscal year 15's meal count numbers. This is because if we use the prior fiscal year, we can't capture that entire federal fiscal year because of the way that the federal fiscal years run. Reimbursement amounts for both federal and state funding changes each year with varying funding amounts that we receive. Meal sites will only be reimbursed for services provided up to the full contract amount. If you happen to be serving more meals than your contract allows, please note that we can only pay you up to that contract amount. And then with your monthly invoices, please know that your payment's based on the monthly expenditures up to the allowable reimbursement amount based on meals served. And this will make more sense as you're filling out an invoice. Program income is a huge aspect of the grants and funding, and this is the income that we receive from via the voluntary contributions from clients. As you can see in the examples, it could also be designated donations. If someone chooses to provide all of their funding amount to C1 or C2, that amount is counted as program income and has to be shown as that as well. These funds have to be expended first and are supposed to be used to supplement and expand the program. Match requirements are also a very large portion of the Title III C programs. So match is the portion of project costs that are not paid by federal funds. Non-federal match requirements for each Title III C program is 15%. State is required to provide 5%, where providers are required to provide 10%. Please know that you have to meet the minimum total match requirement listed in the contract by the end of the federal fiscal year. Most C programs don't have a problem meeting this match requirement, but just know that you are bound by contract to meet that minimum match requirement. Moving on to program reporting, there's about 4 for my C programs. And the first that I've touched a little bit on are the monthly reimbursements. These need to be submitted monthly on the 15th. And this is the reimbursement that you would be getting for the prior month's services. Please know that you have to include SAM's monthly meal count reports and also a profit and loss statement for the corresponding month that you have and are seeking reimbursement for. I also require quarterly financial reports. So these are submitted quarterly, January 15th, April 15th, July 15th, and October 15th. unless noted otherwise. For example, if one of the days of the 15th falls on a weekend, we will notify you when those are due. This is a summary of 3 months expenditures, and they should be matching your profit and loss statement. Meal cost reports are required annually. We have a meal cost tool used to develop guest fees and suggested contribution amounts. This is used as a tool, but also very useful in that it can help you with your financial side of things and where you're allocating your funding to. And then the final report that I require is a satisfaction survey. And again, this is annually. This is just a simple survey to evaluate client satisfaction. And I do have a template with minimum required questions available that I developed, but please know that you as a director or nutrition manager can modify this survey as needed if you feel that it doesn't tailor to your specific site or there's other questions you want to add. And that's all I have in my brief presentation. Again, just please know that referring to the policies and procedures is huge. It contains a lot of information, but it's very useful, and you should be aware of what's going on in those policies and procedures. Here's my contact information. You can reach me with any questions you may have, and I'm always available to answer your questions to the best of my ability. Thanks for your time, and I hope this was helpful.